Welcome to Health System CIO's interview with Bob Schlofelt, Executive Director and CISO at Valleywise Health. I'm Anthony Guerra, founder and editor-in-chief. Bob, thanks for joining me.
Thank you, Anthony. Appreciate the opportunity to talk to you.
All right, awesome, Bob. You want to start off by telling me a little bit about your organization and your role?
My role, well, organization, I'm with Valleywise Health. We are a health system here in Phoenix, Arizona. We are the county hospital for Maricopa County. What that means is we used to be part of the county government. We're sort of are now. We do get some of our revenue from county property taxes, but we are also the what's called the safety net hospital for the county. So in the event there's any kind of disaster, we get called on first. We're also, I guess someone would call us the POTUS hospital for Arizona. So if the president or V POTUS comes to town, they don't necessarily stop by, but if there's an event or something that happens in health-wise, we're the first stop.
I didn't know that. Is that a something I guess in every city there's a
It's
designated
It
place?
depends. It depends on the president. It depends on Secret Service. There was one time last year when POTUS came to town, and one of our other hospitals in the area was called upon because of their. He was going to be visiting there anyway, so it made sense for them to just do that. What it really entails is myself and or the CIO will get a call usually a couple days out from Secret Service, their advanced team to, are you guys ready? Anything we need to know about? Anything going on? With us recently, when VPOTUS came to town, we had just moved into the new hospital. Valleywise built a new hospital next door to the old one. We just moved in 28 days ago.
Mm-hmm.
And so it's kind of a showcase. So it's, all brand new. And so that was one of the reasons that we were picked again. So, but yeah, usually they'll pick a government related facility, not just a private facility. So yeah, and
And it's
being a
go
yeah,
ahead.
being a safety net hospital is just that we're the county entity for Maricopa County, so the largest county population wise in the state.
Right, right. Excellent. Very good. All right. So I know that you have spent, would you say the majority of your career not in healthcare, correct? But in
I've been
security,
I've been in and out. So I've been in
in and out.
healthcare once before with St. Joseph Health out in California. I was a RESO, so regional security officer, and I covered Texas, New Mexico. And then I've been with healthcare companies, sort of uh, a life sciences company that made heart valves, and then of course when it came to Valleywise, True Health System. So yes.
So, with that experience, do you have any thoughts in terms of what you see inside healthcare versus outside when it comes to cybersecurity? Either a commitment to it, percentage of spend, or even risk profile, either being higher or lower. Any general thoughts there?
I think the risk profile will take it from that approach is the same regardless of the industry because a hospital system, we're a county hospital system. Healthcare is a target. And if you think about the bad guys, the bad actors out there who are trying to get data, because that's what they get. They get data, then they try to get money. We have a lot of data. If you think about your medical record, outside of your what your accountant or your tax preparer would have, we have everything. We've got addresses, we've got your medical history, in most cases, everything about your financials, employment records. I worked for I worked for Experian years ago. They have everything, but they don't have medical records, whereas the hospital system, we've got all of it. So from a cyber perspective, anytime our health system, especially our CEO, is very in the news. He's also a member with the AHA and a board member out there. So anytime he speaks, he's in the news. We're building a new hospital, we're in the news. Um, Hospital systems like ours, because we have a big foundation that we look to for funding, so we always try to promote ourselves. We're in the news. Anytime you're in the news, you're going to just be a bigger target. And so we have that concern. Excuse me. So from a cyber perspective, though, and I've had this conversation with some of my colleagues, data is data. We have healthcare data, we have patient data. whether you're in healthcare, financial services, automotive industries that I've been in before, mutual fund management. The data is the same. The tools, techniques, policies that we use to protect and monitor that data really don't change from industry to industry. Healthcare, though, you're going to find, and my last organization before I came here, and this one, it wasn't healthcare, but it was county as well. There's a lot of people that are into public service. People who run for office, people that are work for different public government entities. They're not doing it to get rich. They're doing it to serve. And it's, some people call it servant leadership, whether it be religious or government. They do it to serve. My colleagues at Valleywise Health, some of them have been there 20 plus years. They came up through the help desk, and now they're senior leaders and directors and running big portions of the organization. And I admire that. With security, the uniqueness is, again, I go back to the data. We protect the customer data, so our patient data. Most healthcare systems, and this audience is going to know this already, the physicians or providers, they work for the medical group. They don't work for the hospital. And so we work with them, and we're partnered with our medical group, just like a private hospital partnered with their medical group. When I was with St. Joseph Health, we had St. Jude Medical Group. They were the physicians. And so they're all Providence now, but yeah, they used to be.
So that dynamic of having physicians that are not employed by the health system, but yet need to have an identity, and they need to be part of the network and on the network, but they're not employees. That's pretty unique to healthcare, right? I mean, we don't see that a lot. Usually in other industries, you're an employee, which
Correct.
probably gives you great. So you've got that people in healthcare, CISOs in healthcare have this wrinkle, which how much would you describe that as complicating things or making things more challenging?
It complicates to a certain degree depending on the partnership you have with the medical group. District Medical Group, DMG, which is the group that we work with. We're also a teaching hospital. So we support a lot of the medical schools in the area, Crichton, Arizona, the University of Arizona. And so those physicians are in here doing their residencies, and then they come back maybe as attendings later. But the medical group, it is an interesting dynamic because they're going to have their own unique identifiers, but we onboard them as kind of a pseudo employee in our access management systems, because they need access to the medical record system as much as the clinical staff does. And so it's important to have that partnership with the medical group. And again, I think we have a really good partnership with our medical group. It's getting better, but like any other partnership, it gets better over time. With nuance, there's changes in our medical record system, move to the new hospital, different technologies that come across. The technology piece is one that has really become more important as well in recent years. If you think about a hospital system, and we just opened a new hospital, I think we have 260-bed hospital, which is pretty good size. You think about all the devices. I mean, everybody's got a network connection, and there's computers all over the place and monitors everywhere, but a lot of us are all wireless connected. Some of them are not devices that we can monitor through traditional security measures, endpoint protection and put an agent on there and monitor. I don't allow it. And so we've got IoT devices, that fun word, IoT. And my refrigerator here at home is an IoT device. How fun. And so it's with IoT devices, the challenge of monitoring those and the activity on those can be a challenge, because we got multiple manufacturers out there that create devices, whether it be infusion pumps or whatever it is. They're all managed and they're all on the network. And so we try to monitor that activity as best we can, but it's that network fabric that we have to make sure that we've got that buttoned up. And then we've all seen them before. They call them WOWs, workstation on wheels, in a hospital. They're all over. I mean, they're running around like crazy. And we've got, I don't know, several hundred, I guess, running around the hospital. So those as well, they're workstations that everybody uses. So the authentication, you walk up tap your badge, you do your work, you log out, walk away. Or if you walk away without logging out, it logs you out pretty quickly, shortly thereafter. It's kind of like my truck. I have it set up. If I walk away from my truck and by the time I'm 15 feet away, it locks all the doors. It's like, okay,
Mm-hmm.
good deal. So the challenge is those kind of things are things you wouldn't necessarily find in other industries. I mean, I've been in financial services, worked for a large mutual fund management company. Everybody's at their workstation. I mean, our biggest challenge was, hey, when you get up to go grab lunch or you're going to go to a meeting, lock your computer, all control delete, lock your computer. Getting that to happen. When the hospital system, it's much more critical because patient data sitting there. So we have to audit that kind of thing and look for it. We have to walk around the facility and look for monitors that might be pointed in public view. So, if there's something on the screen that should be only for the person working on it, then we got to make sure that they're all strategically placed. We just went through an exercise of putting privacy screens on monitors, and it took about a day and a half for the nurses to say, no, get this thing off here. I can't read it. Well, because they'll move around, or they'll have two nurses, standing over their shoulder watching something, and unless you're sitting in front of it, you can't read it. And so those went away. So we're working on things like that. So there are a lot of unique challenges in the hospital system.
All right, a couple of fun questions here. Would you say that healthcare, if you were ranking industries, hardest CISO gig, down, what would be your top three? Would healthcare be like one of the most challenging industries to be a CISO in? Or give me your top three from most difficult and then the next two down.
Yeah, well, I belong to a couple of security community groups, and so I have conversations with CISOs from a lot of different industries, including healthcare. Rank the most difficult or challenging. I'm not going to say that mine is the most challenging, but I will, because it is. Well, a couple of things come to mind is hospital systems are a little bit more tight in their budgets because they're not, for the most part, they're not in for profit. Either they're not for profit or they're county. I've got another CISO colleague, friend of mine, who's in retail. So they got retail stores all over, lots of them. And so some of them are owned, some of them are franchised. So you've got that uniqueness there. So that's a lot of challenges, a whole different group of regulations. Some of it falls back to what regulatory body you sit under. If you're, again, retail, you got PCI. If you're a hospital system, you got HIPAA. And we all try to come together in some common ground. So the most challenging, I would say, I'll put a tie between retail and healthcare because of the uniqueness and the vastness of it. Yeah, we don't have 100 stores around town, but I've got, I don't know, a couple dozen clinics, and we've got 3 acute care centers and a couple of medical buildings, and then the uniqueness of the doctors, the providers. They're called now. I keep calling them doctors because I'm an old guy. They don't work for the medical group, and I love them. They're critically important to our organization. Obviously, we have to have doctors. Without them, we wouldn't. Well, without patients, we wouldn't be in business. But without them, but you think about a doctor, and again, I'm saying this in all due respect. In most big organizations, you're going to have an executive team, and executives want things their way, and I would too. I do too. But they want what they want when they want it. And usually have a dozen or so executives, the CFO, the COO, the Cs, the other Cs, including me as one of the Cs. But in a medical environment, all the physicians, they're all considered Cs as well. So you've got, instead of 12 or 15 to work with, you've got 200, 300 that, doctors, I love, they're smart people. Obviously, they went through medical school. And I think I'm a pretty smart guy too. But I get called all the time. Hey, we found this great technology. Can I put it on your network? No, you can't.
Well, how about, do they say put it on your network as opposed to can you put it on your network?
No. Sometimes they've already like, well, we've attached it to the guest wireless. Can we get it over on? No. And then we have a few, and it's happened across almost every industry I've been in. We try to be consistent. For the most part, most of the organizations I've been with, we've been Windows-based organizations. And so with all of that technology and love with Microsoft, but then you get a few folks, it's like they love their app, they love their Mac, they love their Apple. And you try to work with the endpoint protection people. It's like, can I install this? And they're like, no, this is my personal one. You can't put anything on this. It's like, then you can't put it on my network. You know, sometimes as a CISO, you've got to go, no. I mean, we have a challenge. I mean, the other challenges that come across, and I think in the medical area as well, and we're dealing with it like everybody else deals with it, USB devices. You know, we always train people, hey, if you find a USB stick in the parking lot and it's got a fun logo on it, don't just bring it in and plug it in and see what's on it, because you're just, asking for trouble. But the HIPAA requires, and I think it's a HIPAA requirement, so correct me if I'm wrong, that as a patient, if you come in and say, I want my medical record on a CD, or I want it on a thumb drive, we have to do it. Obviously, we give them a pretty intensive disclosure saying, once we hand this to you, we're off the hook for if you lose it.
Mm-hmm.
So USB devices are a challenge. Now, Valleywise, I've only been with Valleywise a year. Actually, it was a year today. I started.
Congratulations.
Thank you. Kelly Summers, our CIO, he
Yep.
recruited me to the position, and Kelly retired a week and a half ago. He's back as a contractor until they find his replacement, and we do some, transfer of knowledge and such. But so Kelly is expired, and I admire him tremendously, all the work he's put in. But they got to a point some years ago. It's like, you want a USB drive? Let us issue you a USB, an iron key. IT absorbs the costs, but here's your iron key. It's encrypted, it's password protected, and so we feel comfortable that the providers or any of the staff, if they need to use a USB stick, then we've given one that's going to protect the data, because our job is to protect the data. But we have our marketing groups. We've got, I just had my list here earlier that I was covering this. So contract people, marketing, radiology, and our biomed teams, they all have a need to put put documents on these devices and either trade them with others or use them elsewhere. So those are all challenges. And we have a challenge now that's, think about it, radiologists, great group of physicians and people that can read those images, and it's quite a talent. They want to work from home too. So set them up so we can push that pretty intense image, usually a lot of bandwidth space, into a high resolution, setup they have at home so they can work that. The other dynamic we run into, physicians, Anthony, you went out and you got your medical degree and you go work for a medical group, and that medical group also serves other hospital systems. So you might do work for Valleywise and Banner and Honor and Children's and.
Mm-hmm.
And so from a data protection standpoint, yep, you've got authorization to do work with Valleywise, but we got to make sure that, one, you're not using your Valleywise equipment to do business with somebody else,
Mm-hmm.
because wait a minute, we didn't provide you the equipment to flourish your business. And on the private side, a lot of physicians, they have their own quote company. They're Bob Schlofelt, MD, LLC. So lots of challenges in those areas. And one of the things that I coach my team on, actually as early as this morning, we'll be in conversations about all the use cases. USB was a good one, all the use cases involved, and I got to keep them focused on, we got to focus on our creating our policy for the 90%. Yes, there's going to be that 1% that's something odd, something weird. But focus on that 90%. Other challenges. So yeah, I think I answered that question. So healthcare and retail are the hardest CISO jobs, and you work your way down the list. I think folks that are in manufacturing, I spent some time with Hyundai. It's not as challenging because it's pretty cut and dried. You're working with franchises again because the dealerships, but the manufacturing side, it's your company. I've worked in engineering and construction. Again, those are things that are pretty static. a lot of different things, but it's project managers and engineers. But it's pretty static to work through the policy there. Um, Healthcare is changing. It's always changing, and their research happens, and yeah.
And you would think that if you had to have a tiebreaker between healthcare and retail, I mean, you're dealing with patients, right? So that's got to put you over the top. With retail, if something goes wrong in healthcare, you have
Nobody
patients
dies.
who could die, right? If something goes wrong
Yeah,
in retail, maybe somebody gets their identity stolen.
they,
Not a pleasant
yeah,
situation, but nobody's dying.
yeah. If there's a failure in retail, and this is a good actually retail, and my wife and I were out to dinner a couple weeks ago, week and a half ago at a restaurant, local place here, and we hadn't got our order yet, but we got our drinks first. Power went out. Sorry, we can't cook anymore. Obviously, we can't collect money anymore, so the restaurant's closed. That was their problem. So it'd be the same with a cyber attack. Oh, you can't do it. But in a hospital system, one, we've got backup power, so the power's not going to go out. We're going to be back up and running. But if we have an attack, or you have a denial of service, ransomware, whatever you want to, something, it can impact patient safety. Doctors take an oath to do no harm, and we take the similar oath that we're going to do everything we can to prevent, any issues with patient safety. And so the redundancy over top of redundancies, especially in our critical care units, operating rooms, et cetera, you don't want the power to go out in the middle of an operation, especially if you're the guy laying on the table. I don't want the power to go out now. I'm wide open right here. So those are the kind of things. So it takes on a little bit different dynamic in a healthcare system. I used to be involved in some groups that were on critical infrastructure.
Yeah.
Natural disaster, who gets services first, second, third, fourth, fifth. And it used to be hospital systems were usually the first online to get power back, to get any kind of services back. That changed, I don't know, probably 8, 10 years ago, where the ISPs, internet service providers, they're first now.
Really?
Everything's run on the internet. If you think about a hospital system, for us to bring our data center back up, yeah, we can bring it up and work it within the hospital, but all those IoT devices, sorry, without the internet, we can't support them. And so the ISPs are anywhere the first, because first responders, the police and fire, so the ISPs, cell service, all those have to come back up first, because that's how everybody communicates that way. And so without them, I mean, think about most businesses, even you and I talking right now, without the internet, we'd have to do this in a coffee shop face to face. I mean, we could have cameras recording it, but
Uh-huh.
after this is over, you do a little editing, click, and it's published. And without it, there's a lot more steps involved. So the criticality of healthcare, in that you've got to look at patient safety. So um,
Well, you make a lot of good points, and what you're talking about the internet service providers and the cell service coming up first, it makes perfect sense. And that sort of dovetails into a little conversation we could have around business continuity and disaster recovery. What I've seen recently with some of these outages that are due to ransomware or whatnot are that it's extremely difficult to practice healthcare without the tools, the digital tools that the
absolutely.
providers have been given, right? It's
Yep.
so hard for them to continue to practice their craft without these tools. It's almost impossible. Um, and that's to your point about that's why internet service provider and cell service are coming up first because because it's not much of a hospital without the technology anymore. How
Yeah.
does that affect your business continuity planning?
Well, we exercise it. And so we do go through, along with the state and the county organizations, um, we exercise business continuity. One of the things that we're pushing more and more is, uh, yes, we have a electronic record system, and it's one of the best out there. They're huge, company out of Wisconsin, yeah. Um, and but can the physicians do paper charting anymore? If they had to do it, if they had to have that chart from and write their notes, and yeah, they got to get transcribed later, but it's the same thing with ransomware. How quickly can we thwart the threat and recover? And so the disaster recovery business continuity piece, we all strive for, the beauty of having active data centers. We don't have a lot of cloud, so we saw a pretty strong data center presence. So having that active data center, because if we had a denial of service or a ransomware attack that were to take down the data center, we have to be able to block it off, fail over, get back to work, because it's patient safety again. So we practice the DR piece. Not my group. There's another group within Valleywise that has disaster recovery business continuity, because it's not just from a security or IT perspective. It's from the hospital itself. They practice it. So if we lost power for a short period of time, or if we lost internet connectivity, or we had some sort of threat, we've done active shooter threats, we've done bomb threats, where things have to change real quickly. In a hospital system too, there's a lot of alerts that go off that we have to practice on. Code blues. We've got a new one that until I started at Valleywise, our previous chief medical information officer said it in his 9 years, it never happened to Code Pink. Code Pink's a child abduction. You
From
think
from the health system? So a
yep,
child was okay.
somebody walks into in the peds unit and scoops up a baby while nobody's paying attention, and out the door they go. We have practiced that one because one happened, a Code Pink happened about the fourth day I was on the job. And I'm like, wow, how does this happen? And the physician who was our CMIO, he said, in his 9 years, it's never happened. Their first one. And so those things happen. You have to practice those things. Just like I have a military background. So military, all they do is practice. That's everything. They practice, 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 hoping you never have to go to war. But you practice. So hospital system, same thing. We have these different codes, and it's like people have to go to certain places at certain times. We get a Code Pink, and there are not just security people, but hospital people are like, you're assigned to a door. Nobody goes out that door. So somebody scoops up a child or a baby and starts heading for the door, who's not not authorized. You're stealing a baby. Yeah, that's a big deal. And we have people, you have to practice these things. There's procedures in place that local authorities get called. There's announcements across the hospital, Code Pink, those kind of things. So there's uniqueness there. There's uniqueness to a hospital system too, because we're a teaching hospital. We've got camera systems everywhere. Some are motion sensitive, some are sound sensitive, so they turn on and off. Anymore, a hospital system, the patients and the visitors, you sign a disclaimer when you come in that, yep, I'm aware that I'm being monitored. As a teaching hospital, our trauma bays, our operating rooms, we have the ability to record procedures for teaching purposes. Most procedures that are done, I mean, the patient's mask, you don't know who it is, there's no patient record with it, but still, that's data that we have to, who has access to it, who can copy it off, how long do we retain it? A lot of policies involved. Areas like that, data retention is pretty quick, because a hospital system, we have data that we want to keep and use in perpetuity, and some of it is like, if it's passed off to the patient, then we're held harmless. If it's for teaching purposes, we're going to have them get it copied off in the teaching library quickly, but off the main systems. We are a county facility, so Freedom of Information Act applies to us. Somebody file it, and I want to see this data, we have to produce it. Now, for policy states, it's gone. It's gone.
Let's jump into that real quick, and we're almost out of time. Amazingly, we've been talking for a half hour. Policies. You mentioned policies a few times. How do you, and I don't know if this becomes an issue, but you obviously need policies to address situations. But is it possible to drown in policies? So tell me a little bit about your thoughts on how to get that right.
Well, I'm fortunate here. We have a chief compliance officer, and his shop handles all policies across the hospital, including the IT policies. Now, my my area, the CIO and myself, we're responsible for the IT policies, enforcing them and updating them. I have a dotted line reporting relationship with our chief compliance officer. So if there's ever an IT issue, then I can skirt around my CIO. Well, he even said it when he hired me. He says, if you see that you've got to report something up to compliance, that is what it is. Protocol is you come to me from chain of command perspective, but you have a dotted line responsibility to the chief compliance officer and the CEO. So, you can go to them directly.
And the point of that is so
Separation duty.
you could never say I was blocked by the CIO
Yeah,
because
and
they'd say you could have gone directly.
it's one of the reasons I had conversations with Kelly before I got hired, and that's a couple of questions I asked that the protocol around there, because if it'd be very difficult for any CISO to um, enforce policy on his own department in IT in one meeting, and your next meeting is you're talking about your performance review, and yeah, you could put yourself in a pretty sticky wicket. So most
Are you talking about the challenges of reporting a CISO reporting to the CIO? Because most places that's how it's done.
most places that's how it's done. A lot of my colleagues who are CISOs out there, and my last shop I came from, I reported to the CEO. I didn't report to the head of IT. And so Valleywise, and Kelly Summers is the one that did this long before, when he created the CISO position like 9 years ago. He intentionally said, no, this position has to have dotted line reporting to the chief of compliance as well as to me. Now, from a day-to-day operational, I'm in the IT shop because my team has to have access and authority to do things within the IT organization to do their jobs. Um, like I said, my last organization, I reported to the CEO. We were outside of IT, so we didn't have the direct admin access that we would to the engineering side
Hmm.
because we weren't in the IT shop. So then it was more driving policy and driving configuration. So yeah, it's a challenge. I think it's going to evolve. I mean, you and I are probably, well, I know I am, but you're probably old enough to know years ago, the guy in security was, in the back room, many layers down, reporting up through IT management, usually on the network team side. But now the CISO role has been around. I've been a CISO now for going on 11 years, 12 years in different organizations. Um, it's becoming a parity where the CISO and the CIO are parallel. They're peers reporting up to either a chief operating officer or sometimes a CFO. Um, some organizations I've been with, the CISO organization reports to legal.
Hmm.
And so it's the way a lot of times when you see that, though, a couple of companies I've been with, the CISO would report up to legal or up to there, but there'd be a security operations group that's still in IT that handles the day-to-day, the operation of the SIM, security operations components, managing endpoints, the technical side of this role,
Hmm.
where the policy shop would be the CISO and policy compliance controls. And so they split the role. Um, I've been a director of security operations, and I'm at a level where I can, be up at that level and be doing that at the same time.
Bob, we're almost out of time. I'm going to ask you one final question, and then I'm going to let you go. You've got some diversified experience. You got your military background. Listen, if we had another half hour, we could go into so many more details.
Sure.
But you've got your military background. You've got background in a number of industries, which you talked about. I want you to offer your best piece of advice for someone in your position, CISO, at a comparably sized health system. So maybe they're new, maybe they're starting out, maybe they're middle of their career, maybe they don't have all the diverse range of experience you have or the military background. What's your best piece of advice to that person on how to be successful in the role?
Discipline is one of the things you've got to look at. You've got to consider, and I've done it before, and I borrowed this information. Again, I belong to a couple of security communities, so we talk a lot. So it's not really Uh, I used to work for Ross Perot in the world, in the academia world, they call it plagiarism. In business, we call it best practices. Uh, I develop anytime I step into a new role. So if I'm helping mentor a new CISO go into a new role, develop a good 100-day plan. You've got to, one, meet all the stakeholders. You got to get to know them, what they do, what their pain points are, uh, both inside and outside the IT shop. So my peers in the infrastructure and application development, service management, PMO, get to know them well. Then look at all the key stakeholders. So all the divisions and departments that we serve, the customers and clients. I've gone away from calling them users because I just learned that years ago. So the customers and clients out there, get to know them well. That's kind of phase one. After you've done that assessment there, you circle back with your boss, your the CIO or whatever the reporting line, and kind of redefine. Okay, you hired me to be. Here's my job description. After this conversation, here's where I think it may need to change a little bit. Then you start looking at what are the policies in place? What's the latest assessments that are done? Latest penetration test, outside assessment. What's the budget? What's the budget challenges? I work for a county entity, so budget is very critical. It's hard to get. You've got to justify it. Not that we're always going to get the cheapest, but we want to make sure we get the best and the best bang for our buck. Sometimes you'll ask for a headcount increase of 3 and you'll get 1, or you'll get none, depending on it. So the county challenges. If you're in private sector, it can be a little bit different. After you've done that, then you've got to sit down as a CISO and say, okay, they hired me for my expertise and my background and my experience. Kelly, myself, we both come from 4 different backgrounds. He was part of the original team that developed the SR-71, so he's got a completely different background from the rest of us. So you got to develop that 3 to 5 year plan on, okay, my assessment, I've been here, I've looked at budgets, I've looked at all the documentation. Continue to follow up with all that, but then develop a plan. Here's where I think it could go or should go. Part of that plan will be, here's what budget I will need to do that.
Mm-hmm.
Get agreement on those things within your peer group. So you can go into infrastructure and say, you've got a lot of systems that need to be upgraded. It's a risk to the organization. And okay, let me help you get budget for it. So, but all along the way, it's the constant communication. So anytime I have an opportunity to share my vision or what I've done with not just the CIO and my own peer group, like I said, it just came off the senior leaders meeting. We meet every Wednesday. I share with what I'm doing because if you're a CISO and you sit in a vacuum and try to policy says, and you try to make demands,
Mm-hmm.
your success is going to go downhill real fast. But if you work with those people and develop those relationships, then you can move things forward in a secure manner. And you're going to run into bumps along the way. You're going to run into business units and say, nope, not going to do that. I'm going to do it this way. And then you have to be eloquent, present them with the risk, and then also present them with, if you're willing to take this risk, I need you to document that you're willing to take this risk and sign off on it. Because it's happened more recently that we have an issue, we got breached, we got attacked, and the CISO's got to update his resume.
Mm-hmm.
So I'm to a point now in my career where I don't want to update my resume again. And I'd like that if you want to, as a business unit, I'll pick on radiology. Yeah, they're a good one. They're not doing any risk, so I'm not throwing them under the bus. If they wanted to take some risk with a technology and I said, no, I don't want to do it, and they can have a compelling argument and say, we want to do it and we'll accept the risk. Okay, you're signing off. I'm handing a piece of paper in front of them. You're signing off that you're accepting the risk, and this will be shared with the executive team and the board. A lot of times they're going to change their mind. But if they don't, then I've got my get out of jail free card. So it's like, 6 months later, hey, this system got breached, and hey, CISO, what'd you do about it? It's like, well, they accepted the risk, and we did everything we can to protect it, but still, they opened the door.
And does that also go to, if you make you do your rounds, you start the job, you do your rounds, you find out what the problems are, you develop your plan and you
Mhm.
propose your plan along with what you'll need financially to execute your plan. The organization comes back and says, we can give you half of what you're saying you need to do what you think needs to be done.
Yep.
How do you respond to that?
You respond to it from a risk perspective, that you look at your plan, you would prioritize at that point saying, okay, I understand budgets. I understand that you're not going to just give me a blank check. I didn't expect that. But then you go back with, here's the high risk items that we can do.
Mhm.
These are the lower ones, and you need to keep communicating that.
Mhm.
And then every opportunity you get to request budget or request some change, like, okay, we can't do it this way, we can do it this way, and work it out. Um, with us, and we have a relationship with the state of Arizona and state's Department of Homeland Security. We get leverage there in a lot of areas. They have tools we can utilize and no cost to us. Yay. Um, so so you work at the priorities, but the key to success here is constant communication
Mhm.
with those who are going to be making the decisions. So being a trusted advisor, we hear that term all the time. You want to be a trusted advisor. For me, my success here was when our CAO, Chief Administrative Officer, or the CEO, or the Chief Medical Officer, when they reach out to me directly, not through my boss, and ask questions, or hey, can you give me advice on this? Or I got this email. Is it real? That to me was the biggest success, because they trusted me to just deal
Mhm.
with it.
Mhm.
They didn't bother Kelly or head of infrastructure or any other department head. It's like, okay, this smells funny in security, so just call Bob.
Mhm.
To me, that was the good mark of success, when our CEO can reach out to me directly and say, hey, did you see this article? How does it impact us? Hey, did you
Awesome.
see this? How did you know? And
And you
so
build that trust. That trust gets
you
built.
build that trust through communication. And sometimes you got to tell them something that it's not good news. We've got this issue. Yep. I had one last week. We'd finished our open enrollment. We rolled over to the new quarter, and we got this email blast saying, "Hey, open enrollment." I was like, "Whoa, whoa, this isn't real."
Mhm.
So I quickly developed some comms and pushed it out to the whole company saying, "If you got this email, delete it, because we're already done with open enrollment. HR did it. We're done. So you're getting this. It isn't from us." So you got to communicate, and communicate quickly. And then from my engineering team and my access management team, trust they do their jobs.
Yeah.
I don't like to micromanage. I'm the management style of, here's our approach, here's what we need to accomplish, here's the timeframes we need to accomplish it, here's what is expected of us. Go do your job.
Yeah.
And my job is to stand between you and the bullets coming at us.
Right.
So, and I told the CIO this once. I said, if we're ever working an incident, and we have before, don't call directly to one of my engineers to get data, or don't call me and say, hey, I need you to talk to so and so because I want to find out where the status is. Like, I'll get the status, you don't get it. I'll leave them alone because they got to do their job.
Mhm.
Every time I've got to call one of them and say, what's the status on whatever you're doing to fix something, that takes their time away from what they're doing.
Mhm.
It's like, I get status with them on a regular cadence. If you want status outside that cadence, then I've got to change my expectation on when it's going to get done, because you're making me get in their way.
That's right.
Don't get in their way. So
I love it. I love it, Bob. Bob, this was an awesome conversation. I
thank you.
really, I really appreciate your time today. And I hope I can reach out to you in the future. So thank you so much.
Please do. Looking forward to seeing.